Hi, I'm Rob Coen. I'm the NITAAC Program Director, and I manage the CIO-SP3, CIO-SP3 Small Business, and ECS3 Government-Wide Acquisition Contracts for the National Institutes of Health. These contracts are set up to be used by any federal agency and provide a quick, efficient, and quality way for any agency to be able to acquire information technology. Sure. So the NITAAC program is a acquisition program run out of the National Institutes of Health. It is one of the 3 government-wide acquisition contracting programs that the federal government offers. It is a program that is set up as a shared service that can be used by any federal agency to order and acquire information technology, both services and commodities and products. So basically they are large IDIQ contracts that can be used by any federal agency to quickly and efficiently place task and delivery orders to get their mission needs met. Yes, so right now we have 3 government-wide acquisition contracts. The first one is CIO-SP3. That is an IT services task order IDIQ contract with a $20 billion ceiling. And again, that contract can be used to acquire any IT services and is split up into 10 different task areas that covers the entire scope of information technology. The second contract is CIO-SP3 Small Business, which is a contract with the similar scope to CIO-SP3, but the major difference is that it is made up entirely of small businesses. You have a contract that has the 5 socioeconomic groupings of service-disabled veteran businesses, hub zone businesses, 8A businesses, and women-owned businesses, as well as the general small business category. So any agency can come to that contract and quickly and easily do a set-aside requirement to any one of those groups in order to get their IT service acquisitions met. The third contract we have is ECS3, and that stands for the Electronic Commodities Store. That is mainly a IT products and related services contract. That contract is coming to an end at the end of this year, and we're replacing it with a new GWAC called CIO-CS. Which stands for the Commodities and Solutions. That contract is designed to meet all of the future technology needs that the government is going to have, as well as to provide a contract that you can buy your products on, but also an emphasis on cloud and commoditized solutions and services to really be a contract that's at the cutting edge of all the new and upcoming managed type services that the government is buying. Well, NIH was chosen back in the 1990s because of its experience and work they had done to ensure and to build an infrastructure to be able to manage large IDIQ contracts for information technology. And over the years, the program has evolved and been seen as a leader in the IT arena. Both by federal customers and by the contract holder community. And NIH continues to build upon its success to ensure that we have a quality program that any federal agency can utilize. So the biggest difference between a GWAC and any other contract is that a GWAC is designed to be used by any federal agency. It's a government-wide contract. It is managed by the Office of Management and Budget. The 3 GWAC programs that the federal government offers report directly to OMB, and it came as a result of the Clinger-Coen Act, passed back in the late 90s, which was designed to provide a mechanism for agencies to quickly and efficiently acquire information technology in a manner that is cost-effective and through contract holders who have proven their capability to be able to provide high-quality service to the government. One of the reasons that the GWACs were established were to provide an efficient way to buy IT, to provide a quicker way to buy IT with cost savings as well as the efficiencies that have been put into place through the infrastructures that the GWACs have. We have ordering systems that provide an easy way and a quick way of a customer or a contracting officer to be able to go in and issue a solicitation that goes out to our contract holders, and we have contract holders that are able to turn bids around quickly so that an agency can go ahead and cut down on the time or the lead time in order to award a task or delivery order. So any contract officer can come to our program and get the support for any part of the contracting cycle. So you can get support from the acquisition planning, right through to the solicitation phase, right through to the award phase and the administration of that task order. We do statement of work reviews. We assist the customers with developing statements of work. And we assist customers if they have any issues with the administration of a task or delivery order, right through to the closeout of that order. So a CO or acquisition professional that's using our contracts can come to us at any point or any time throughout the acquisition life cycle and get support from our office or get any questions answered that will help them be able to get their mission needs. So NITAAC is housed here at NIH, and our primary focus is to ensure that NIH meets its mission goals. And one of those is health IT. So we provide contracts that are set up so that every contract holder has been vetted to ensure that they're able to provide that health IT niche. That is not only for NIH, but it is for the Department of Defense and many other agencies who have that niche within their mission. So each and every one of our contract holders, in order to receive an award on our contracts, have to prove that they have a health domain specific capability in health IT. DoD is actually one of our largest customers. We work very closely with the Department of Defense at the Department of Acquisition and Policy. We have an agreement with the Department of Defense that allows any contracting officer at DoD to use our contracts. We also have been designated by the Navy as a preferred source when buying IT. So we spend a lot of time working with DoD customers, spend a lot of time visiting their offices and providing training on how to use the contracts. But again, DoD is one of our most valued and largest customers. Sure. Well, we do charge a fee to use our contracts, and that fee is used just to pay for the program that we run. All of the fees are used just to cover the infrastructure and the personnel that work in this program. The fees are capped. There's a 1% fee for CIO SP3, and it's capped at $150,000. There's a 0.75% fee for the CIO SP3 small business contract, and that is also capped at $150,000. And currently on the ECS3 contract, the fee is 0.5% with a $10,000 cap. So the idea or the what we're trying to do is increase the volume of the use of the contracts in order to cut the fees, because at the end of the day, all we're trying to do is save the taxpayers money, and the more we can cut the fees, again, it saves the agencies money. So that messaging is just to try to get the customer to understand that what we do is we provide a quality program with quality contracts and quality customer service, and we provide the guidance to the customers, but that the customers control their requirements, that they are, when they come to our contracts to issue task and delivery orders, that they drive the control, the features of that task and delivery order, the terms and conditions, or the agency-specific requirements, that they are in complete control and manage the award and the administration of all of those orders as if it was their own. So we have professionals that have 20 or 30 years of experience in working with IT acquisitions. And those professionals are able to look at a statement of work and pick out any areas of concern that maybe need to be addressed to ensure that a statement of work is written in such a way that a contract holder is able to bid on it, that there will be sufficient competition, and that there is, and look for any gaps in that statement of work that need to be addressed, and provide templates or wording to the contracting officers so that they can be, ensure that they have a quality product when it hits the street. Well, the contracting officers love it because it's very easy to use. It's very customizable, that they can add terms and conditions, they can customize the orders to associate with what they're trying to buy, but also they love it because they have us to help them. The service that we provide to them, the customer service, the support, any questions they have throughout any phase of the acquisition life cycle, they can call upon us, and we have a customer support center that responds to every single inquiry that comes into the office within 1 hour. and or any email that comes into this office is disseminated within 15 minutes and answered within an hour. So the customers really love the support they get from our program. Recently we've developed many new web tools, but they're all based on the electronic government ordering system that we've developed, and provides a mechanism for a contracting officer to go into and post their solicitation for us to review, and then it gets posted to the contract holder community for them to submit their bids through the system. The customer can use that to have clarification and discussions with contract holders through prior to award, and then they use the system to post the award. So the system is a robust system that is very easy to use, constantly being enhanced with suggestions from our customers and from contract holders. And we rely on that system to provide the quality of ease of use for our customers. And it really helps manage the life cycle of the task and delivery order, life cycle of those orders. We also have a support center for our contract holders, where the contract holders can send in questions or emails, or call us with any concerns that they may have, or questions about the contract, and we have a team of people that are here to support them as well.